watching Let's Chat.
This week is National Pulmonary Rehabilitation Week. What does that mean and who is this for? Here to answer all of those questions, Mr. Matt Thomas. Matt, thanks for joining us.
Hi, good to be with you.
All right, let's start off with who needs pulmonary rehabilitation.
Yeah. So pulmonary rehab has a few different phases, but to quickly answer your question, it's anyone who has a chronic lung condition and has talked to their doctor, usually their pulmonologist, about the potential benefits that an exercise program and pulmonary rehab can have from them. So these are physician-referred programs.
Perfect. Now, a lot of people may not think about, using a therapy program for an internal organ. We think about it for an injury, to an ankle, to a knee, to a shoulder, but it's just as important.
Yeah, absolutely. And that's a good connection, too, because we kind of refer to ourselves at times as physical therapy, but for some of our internal systems, the cardiovascular, the lungs take damage, too, and they can take damage over time. So what we try to do in our therapies is slow that disease progression and work on the complementing systems to make them stronger and ensure people are able to do the things that they need and want to do each day.
Well, you were touching on it, but dive a little bit deeper into how this really helps us improve our lung health.
Yeah, so the lungs, and we have different mechanisms. So smoking is probably the most common thing we think of when we're talking about debilitation of the lung, but exposures to environmental factors and sometimes just general aging, the lungs lose their elasticity or their ability to move back and forth, kind of like an accordion is a good way to think about it. And these therapies help the complementing muscles that move the lung, so it improves breathing. And exercise is such a global benefit, it improves all the muscles of the body too, so you get a real good benefit through all of the systems.
Take us through, I know no treatment is standard. Everyone is different, and it's going to be a customized approach for everyone. But what's the normal routine look like? Yeah,
so one of our big jobs is to remove barriers. So we understand that it is very difficult to be told to go and exercise and be part of a rehab program. So we set up an individualized treatment plan. So we meet with our patients, talk about goals, identify what it is they want to do, what do they need to do, and we're really focused on maintaining independence. So we'll make an exercise prescription, we'll talk about diet, understanding of medications, and really tailor a program to the individual that way.
And when you say exercise, it's not going to be anything that's too difficult, though. A lot of people might get worried on that.
Yeah, exercise is a daunting word, but we really do focus on some functional assessments up front, so we look at our capabilities, and then we are doing things, again, we don't want to make people better exercisers per se, we're just using exercise as a convenient and a safe way to be able to do those activities of daily life that are so important.
And you mentioned multidisciplinary earlier, especially when you're looking at how to create that custom approach for everyone. How does that tie into your team?
Yeah, so we have a multidisciplinary team, and what that means is that we have clinical exercise professionals, we have respiratory therapists on staff, and we have registered nurses, and they're all part of the care team that will be working with the patient. May interact with all of those on any given day for the treatment.
Again, making sure we're getting exactly what we need. Now, and everyone wants to know this question. They're like, well, how much is this going to cost me? Is this something insurance usually covers?
Yes, so as being a physician-referred program, these are reimbursed by insurance.
Good news. Perfect.
Yeah, absolutely.
All right, for more information, of course, if we have already been referred by our physician, they have some information. But if it's been a little bit since that conversation, what do we need to do to get started, Matt?
Yeah, just call our center, 423-495-7764, and just generally ask us, hey, I want to know more about your pulmonary rehab program. We'll give you all the details over the phone.
Perfect. Of course, you can always find additional information 24/7 online at memorial.org as well. Matt, thanks for joining us.
Thank you.
Great to talk with you. All right, we'll be right back with more on Let's Chat.